Welcome to Real World NP's Clinical Pearls, where we take gems from full-length episodes and break them into quick, digestible insights. I'm Liz Rohr, family nurse practitioner, and my pronouns are they, she. Real World NP is a continuing education company for nurse practitioners in primary care, especially new nurse practitioners navigating the role transition from RN to NP. Whether you're on your commute between patients or prepping for an exam, these bite-sized takeaways can help you build confidence in your practice. Let's dive in.
This week I'm going to be talking about HSV types 1 and 2 and the overall approach to diagnosis, including the lab testing. So when it comes to HSV, it is incredibly common. So HSV1 and HSV2, statistics estimate about 1 in 6 patients have HSV1, and about 1 in 20 people have HSV2. It is a lifelong infection that hangs out inside of the trigeminal ganglia or the sacral ganglia, depending on the site of infection. And in fact, HSV1 has been thought of as the oral infection when it can affect either oral or genital locations. Same thing with HSV2. And the reason I give those statistics and this other statistic, I tried to find as many as I could. Only interestingly, it's based on population studies, of course. So the data varies, right? But for the most part, it sounds like about only 20 to 25 patients with HSV1 have ever had clinical symptoms. So it is very possible that somebody has that lifelong infection, but they have never had symptoms and never will, which really ties into the testing and the patient counseling. Again, we'll circle back to that. So when it comes to the infection, it tends to occur, symptoms tend to occur about 4 days after exposure, anywhere from 2 to 12 days. And then the symptoms that patients will get really depends on a couple of things. It depends on the site of infection, whether it's oral or genital. It depends if it's a primary infection or a non-primary initial infection or recurrent. So primary infections refer to when patients have never been exposed to either HSV1 or HSV2. And those situations of being seronegative going to having an infection the first time, either strain, are more likely going to have more severe signs and symptoms. To be clear though, not everybody has a severe presentation, even if it's a primary infection. So some patients will have subclinical symptoms, something very mild, or they might be completely asymptomatic and become a carrier. Like I said, with HSV1, only 20 to 25%, based on the studies that we have shown that those patients who have HSV1 in their systems have ever had clinical symptoms, right? So non-primary infections refer to when somebody's been exposed, for example, to HSV1, and then they become exposed to HSV2, the symptoms tend to be a lot more mild because even though they're two different viruses, they have enough in common that that initial protection from HSV1, as HSV2, vice versa, will allow that kind of next iteration of infection to be a lot more mild typically. So the most kind of severe primary presentation when it comes to either oral or genital site, either HSV1 or HSV2, when it comes to the oral location, it actually in adults tends to present as a pharyngitis or as multiple oral lesions. And recurrent infections tend to be on the vermilion border, like the typical cold sore of what people think about. It tends to be the recurrent infections and not the initial infection. And so the more severe initial primary infections can have things like malaise, headache, fever, cervical lymphadenopathy, tonsillar exudate, about 40% of people, I understand, and as well as like some pharyngeal edema too. So it can be a pretty significant presentation that sounds a lot like strep or initial presentation of HIV. It sounds like quite a number of things. So it could potentially be the initial infection of either HSV1 or HSV2 just in the oral location. And so again, primary infection of either HSV1 or HSV2 and the genital location can be really painful inguinal lymphadenopathy, again, malaise, fatigue, headache, bilateral ulcerations. It can be vesicles, a grouping of vesicles on an erythematous base, but again, not everybody presents that way. That's kind of the classic textbook presentation, and I don't really have stats on that in terms of how many people present in that way, but just know that it can be shades of that presentation, and it doesn't always have to be the exact one. And there's no real clear differentiation, clinically speaking, looking at the vesicles or ulcerations that go with HSV1 or HSV2, and most of the vesicles will progress to ulcerations infections that are exquisitely painful. And the duration of the infection tends to be longer and more severe with those primary infections versus the recurrent ones or the non-primary initial ones. And the symptoms can last, for oral lesions, can be about 8 days or so of that exquisite pain. And then for an initial genital infection can be to the range of about 19 days. It can last a long time. But the recurrent infections tend to be a lot shorter, 5 to 10 days or so.
Enjoyed this clinical pearl? There's even more valuable insight in the full episode. Click the link in the description to hear the complete discussion, packed with practical tips to strengthen your skills and confidence as a nurse practitioner. Don't miss it. And if you found this helpful, be sure to like, subscribe, and share with your fellow NPs so we can keep learning together.